Tom asked me if I'd talk to you a little bit about the Pitts aesthetic discipline. The Pitts aesthetic discipline has been around for years. Tom has been working on this for at least 20 or 30 years. The key is that in the Pitts aesthetic discipline, we want to produce beautiful faces, beautiful smiles, beautiful teeth, healthy functional occlusions, and healthy periodontal conditions. This is what, for us, defines a wow-worthy result. It's generally conceded in the profession that our KOLs are producing the best orthodontic results that there are. These wow-worthy results are our story, but you know less about what we're doing for jaw joint function or periodontal health. We tend to apply current levels of research with current knowledge and clinical experience. We tend to be goal-directed, and we start off by looking at patients in natural head position. And the reason for that is that we know that posture contributes to malocclusion or occlusion. We know that there are relationships between posture and what you're seeing. So we tend to examine the patients initially standing up. We then perform a functional evaluation that is similar to what you're doing now, but we add video to it to have a look at what the joint is functioning like. You can trace opening and closing patterns, look at the position of the tongue, look at the margins of the tongue, find out if they have a click. You can also trial treatment by opening the bite and seeing if the joint function improves. This is a good trick. In any patients that have the triad, sounds, limitation of movement, or pain, we assess them with CBCTs, and that's true even in kids. Roughly 20% of the patients in your practice that are children will have signs of a temporomandibular joint disorder. That's why we treat them early. If you look at these things, these are the things that people consider to be important as precursors to jaw joint problems later. This looks like every kid in my practice. We look at CBCT differently than other people. Not only do we look at the osseous components, but we look at the positions in space. We have a goal-directed aesthetic exam where we look at what we want to attain, and then we take photographs on every patient, every appointment to see if we're attaining it. In terms of occlusal and function, we're the same as you. None of us were trained very well. The training in school was rudimentary, and that has resulted in the knowledge out there tends to scare people off. They don't treat jaw joint problems very often. We think that temporomandibular joint treatment is multifactorial, so we have a team approach to it. We do know that occlusion matters, that occlusion contributes to dysfunction. We disagree with the standard orthodontic position that occlusion has nothing to do with joints. That's not true in our view. But making it more complex does not help. The science is very clear. There is no justification to mounting every orthodontic case. Even the people that do it all the time don't like it much. We know that CR is largely a theoretical construct. A position of orthopedic stability is important. We don't use articulators except in surgical cases because articulators do not mimic jaw movement well. And even the very, very complex technologies of today, things like mod jaw, there presently is no evidence indicating that that is beneficial. We do know that if you have a discrepancy between MIP rest position and an orthopedically stable position, that's bad for you. And so we tend to look at those carefully. We assess them, aim, and then shoot. We use a lot of orthotics. Everything means something, but not every something matters. And nowhere is that more true than in jaw joint treatment. We do use Tom's protocols because Tom's protocols are the best in the world. We tend to upright, procline teeth. We do not tend to retract upright teeth. That's a hallmark of Tom's diagnostic process. We do use SAP VID bracket positions to extrude teeth, because if you extrude teeth for aesthetics, the aesthetics get better, and SAP VID bracket positions help that. The key is that these changes in aesthetics are not attained by deepening the overbite. We use Tom's protocols, and we assess them regularly to be able to tell whether we're actually getting what we want to get. Upright teeth function perfectly well. The incisal angle matches the condylar angle, and as long as you don't deepen the overbite, these things function very, very well. If you retract incisors too far, or if the overbite is not optimal, then it can cause you joint problems, which you see later. This is being evaluated now in very complex things where they're looking at the joint function, they're looking at the interincisal angles, and they're looking at jaw function using very sophisticated tools. And they are finding joint function is reflective of incisal angle, overbite, overjet, and incisal guidance. So occlusion is very important. We use early light short elastics and disarticulation. And we use that all the time. The key is that the disarticulation distracts the condyle, so it protects it while you're running elastics off the teeth. It's one of the lesser known aspects of disarticulation. We also know that these changes that are induced in condylar position are transient. They go away when you take the bite turbos off. We change the bite turbo position on a regular basis. And we use very, very light elastic forces, stuff that isn't going to overload either the teeth or the joints. The disarticulation protects the joints. We do not use reverse curve arch wires. We use bracket position. And the reason that we do that is we find that anterior bite turbos are far more effective in opening bites than reverse curve arch wires. Eventually, we take off the turbos and we adjust the occlusal stops by doing occlusal adjustment. That helps to seat the condyles and make them function well. And that's true whether you use very sophisticated instruments or you just use articulating paper. So, the Pitts aesthetic discipline. We want you to get beautiful faces, beautiful smiles, beautiful teeth, healthy functional occlusion, and very healthy periodontal conditions. And that's what defines a wow-worthy result for us. This is a wow-worthy result. If you'd like to learn more, come and join us at the Pitts Masters. We'll be starting another one in May, and we'd love to see you. Thank you very much for spending your morning with me. I really appreciate it.